New numbers out today show for the first time since the pandemic started, more people have been hospitalized in this state with the flu than with COVID. The number of people hospitalized with the flu jumped 84% week to week. COVID up 24%. 1 in every 5 visits to the emergency department, whether the patient was admitted or not, involved a respiratory issue. That's flu, COVID, and RSV. A number of hospitals in our area are changing their visitation policies to keep viruses out.
Cape Fear Valley Health Systems is going even a step farther and modifying its mask-wearing policy. WRAL Fayetteville reporter Gilbert Bays spoke with a doctor who explained the changes they'll be seeing in the emergency room.
Well, this story is all about the numbers. I talked to an ER doctor who says the number of patients coming in with respiratory illnesses is up and many are being hospitalized. It's no secret, people are starting to flood the emergency room here at Cape Fear Valley Medical Center. We're told an alarming number are testing positive for several respiratory illnesses.
Yesterday we had 249 some odd viral panels run in the hospital. Of those, half of them returned positive for either COVID, flu, or RSV. The bulk of those were positive for influenza.
The numbers are nowhere near what we saw during the COVID pandemic, but patients are being hospitalized, many with influenza, and that has doctors concerned.
We are concerned. When you're seeing volumes like this, it stresses the entire system. We're in one of those periods where we're just seeing high volumes of respiratory illness.
The rising numbers have forced the hospital to change its mask-wearing policy in the emergency department. Patients in the ED waiting rooms must wear a mask. Visitors will not be allowed in the adult emergency department waiting room. And visitors with symptoms of a fever or respiratory illness, including a cough or shortness of breath, should stay home. But there are a few exceptions.
Children are allowed to have one visitor or one parent or guardian with them, as well as folks that are over the age of 65 or folks that have mental illness or incompetence or issues where they would not be able to make decisions for themselves.
So right now the policy on masking applies to people in the emergency room, but doctors say it's a pretty good idea to keep your mask on anywhere in the hospital. In Fayetteville, Gilbert Bays, WRAL News.
It is that time of year. Hospital administrators and doctors are encouraging everyone, especially children and older adults, to get respiratory illness vaccinations.
And hospital systems here in the Triangle are limiting visitors because of viruses. Duke Health announced its changes this morning. As of Wednesday, patients can only have 2 visitors. Children under 12 cannot enter hospitals without prior approval. UNC Health says as of Tuesday, all children age 11 and younger cannot enter inpatient areas and waiting rooms. Visitors with respiratory symptoms cannot enter these areas either. WakeMed also stepping up its rules. As of Tuesday, visitors in all units must be at least 12 years old.